Professor Rapoport, you're famous not only as headache expert but great clinician.
Yes.
Can you answer the question, please? Which is the best treatment for acute migraine attacks nowadays?
Well, in the United States, we like to use triptans for acute migraine. Certainly if it's a severe migraine or one that might last a long time or might cause a lot of disability. And we have 7 triptans available in the United States by tablet. We have 2 melt tablets. We have 2 nasal sprays, and we have an injection. And we like patients to take their triptan very early at the start of a headache. And if it hasn't helped with that headache in 2 hours, we ask them to do another dose of that medication. One of the problems with triptans is they are expensive. Another problem is they do constrict blood vessels, so we have to be very cautious to give them to people that do not have any cerebrovascular or coronary vascular disease or high blood pressure. But when they're available, we like to use triptans very early.
When it's a moderate headache, would you start with aspirin or still with triptan?
Well, I might have, if it's a moderate headache and the patient doesn't have too much disability from their headaches, I might start with something that's a little less expensive, maybe have fewer side effects like a non-steroidal anti-inflammatory. And there are some people that can take just an aspirin tablet or an acetaminophen tablet or something with caffeine in it and feel better. But if they have severe headaches, it's not a good idea to start with a less strong medicine, because what happens then, 2 hours go by, they're not doing well, and when you give the triptan too late, some patients, because they've developed central sensitization, do not do very well. So you can use less strong medicine, but you have to know what kind of attack and what the patient is like.
And what is your favorite from prophylactic treatment drugs?
Well, we have only 4 drugs approved for prevention of migraine in the United States. And of those 4, I think the one that works the best, which does have some side effects, but not that many that the patients can't take it, would be topiramate, which we call Topamax. We have to be cautious about it also because it does get into the brain and causes central nervous system side effects. But if I had migraine and I had enough money to buy the medicine, which is an important point, I would use topiramate. But there are patients who have high blood pressure and migraine. They could take a beta blocker.
And what is your poster about?
And
let us have a look.
My poster is about zolmitriptan, which we call Zomig nasal spray, in the acute treatment of cluster headache. Cluster headache doesn't have too many acute treatments. One of them is breathing pure oxygen, and one of them is an injection of sumatriptan. And we said it might be very helpful to just take a nasal spray so there are fewer side effects, and so the patient doesn't have the pain of an injection. And so we did a 4-center study in the United States trying 5 milligrams and 10 milligrams of zolmitriptan nasal spray for cluster, and we found that it was very, very helpful, not too many side effects, and began to work within 10 minutes when we used the 10 milligram zolmitriptan nasal spray. And injections also work very quickly, but I would rather take a nasal spray than an injection.
What is your attitude towards generic drugs? They're much cheaper, but probably have...
Well, I have 2 attitudes. As a physician, I like to give the drug that's best for the patient. And I think brand name drugs may be better in some instances than generic drug. But as somebody that cares about healthcare in general and cost of healthcare, I believe that if you really have a bioequivalent generic and you try it on a patient and it works, that's a good thing to do. But some of my patients will actually say to me, that medicine you gave me doesn't work, and then I try them on the brand name and it does work. So there are some differences between brand name drugs and generic. But generics are a good thing from a cost point of view.
Thank you very much, Professor. Wish you prosperous work.
Thank you.